In this video, we are going to talk about, can diabetes be reversed, and what exactly does that mean? In a previous video, we went over a lot of possible diabetes complications. With all of those complications, it's no wonder that people want to know if they can reverse their diabetes. However, this is actually kind of a loaded question because reversed isn't well defined and can be used to mislead people. And this is actually a common pitfall with other diabetes programs. They promise reversal, but they don't clarify what that means. So here are a few things that people might mean when they say reverse diabetes. It may mean that you can have improved or well-managed blood sugars. If you previously had very high blood sugars and now you have well-managed blood sugars, that could be considered a form of reversal. They may mean decreased insulin resistance. If type 2 diabetes is caused primarily by insulin resistance, which it is, and you decrease your insulin resistance, well, you just change the direction your diabetes is going. And this is actually what I mean when I say to reverse diabetes. Your diabetes was getting worse and worse because your insulin resistance was getting worse and worse. Now your insulin resistance is getting better and better. We have reversed the course of your diabetes. Another thing that people might think is meant by diabetes reversal is improved insulin production. Remember that over time when you have type 2 diabetes, your pancreas is making less and less insulin. So to reverse that, your pancreas would need to make more and more insulin. And that could be one thing that crosses your mind when people say, can diabetes be reversed? Another thing that it could mean is to get your diabetes into remission, which means normal blood sugars or even pre-diabetes blood sugars without medication. Now that could be considered reversal. But what people often think of when they hear the word reversal is a cure, where you don't have to worry about diabetes anymore. You can eat what you want, you don't need to take meds, you just don't have to worry about it. So let's go over in a little bit more detail each of these things and see if they are possible, who they are possible for, and how to avoid being confused by these terms. So first of all, improved or well-managed blood sugars is when your blood sugars are staying mostly within your target ranges, whatever you and your healthcare team have determined that to be. Management of your blood sugars is usually always possible with the right combination of lifestyle changes and medications, and also with support from your healthcare providers and with you keeping an eye on things as well. Your management plan will likely include checking your blood sugars, changes with your food, adding in physical activity. It could include medications. It may also include some changes in your other habits such as smoking, drinking, and even your sleep patterns. It also includes stress management. So with the right combination of these things, anyone can have what is considered to be well-managed blood sugars. Now, I want to be sensitive. There are extenuating circumstances that can make managing blood sugars very difficult, but in general, with the right approach, we can get your blood sugars well managed. So what about decreasing insulin resistance? Is that something that we can do? Well, let's step back and look at what insulin resistance is again. So insulin resistance is when fat is gumming up the LOX, and when that starts getting removed and insulin starts working better, we are decreasing your insulin resistance, or to say it the other way, we are improving your insulin sensitivity. Now, it's widely accepted in the medical community that we can reduce insulin resistance. Whatever insulin the pancreas still makes, or whatever insulin is injected, works better, and so less is needed, or maybe no injections would be needed once you have optimized your insulin sensitivity. How do we accomplish this? And this is key. We accomplish this by eating less fat, specifically saturated fat found in animal foods. We do also want to avoid sugary foods and processed foods, and also increasing physical activity. I will be going into much more detail about this in later videos, but this is an overview of what we're going to be looking at throughout the program. We're going to be decreasing fat from animal foods and also decreasing sugary and highly processed foods, and hopefully adding in some physical activity as well in order to reverse your insulin resistance. Right now it's getting worse and worse. We want to stop that in its tracks and for it to get better and better. And this is what I'm talking about when I say reversing diabetes, because this is the underlying cause of your diabetes in the first place. Okay, so moving on to improved insulin production. Once your pancreas starts making less insulin, is it possible to get that production back? This is a tricky question because the research in this area is very new and we just don't know that much about it quite yet. Most healthcare professionals that I've spoken with tend to believe that it only gets worse, not better. However, as far back as 2011, we started to have some studies that showed this to not be the case and that the insulin production can actually start to improve when your triglyceride levels that are being stored in the pancreas are lowered. So it may actually be able to improve. It's not an area we know a whole lot about yet. The best bet for reversing your diabetes is to catch it while your pancreas is hopefully still making some insulin. Now, when people go about trying to help their pancreas work better, this is often achieved through starvation diets or through surgery like weight loss surgery. And this decreases the triglycerides. However, a decrease in triglycerides can also be achieved through eating more whole plant foods, which is what we do in this program. So, in other words, if you would rather go on a semi-starvation or starvation diet or have surgery, that would be a route that could help your pancreas make more insulin. Or you could simply adjust your eating habits and that could help your pancreas make more insulin. One of these sounds much less extreme to me than the others. It's kind of interesting because sometimes when I tell people about this eating method, they say, oh, that sounds way too extreme. Well, it's a lot less extreme than the other options, and it's definitely less extreme than not making changes and heading instead towards the consequences of continuing to have high blood sugars and things like that. And I do have here for you a little picture of what a triglyceride is. A triglyceride is 3 parts fat and 1 part sugar or carb. So it's made up both of sugar and of fats. So that's the reason why we are especially looking at reducing our intake of the types of fats that go into triglycerides, and we're also reducing or removing our intake of simple sugars for other reasons than just this, but also because we want to reduce triglycerides that might be impacting the pancreas as well as our liver and other organs. Moving on to talking about remission. A lot of people have never really heard this term in relation to diabetes before. So what is diabetes remission? Diabetes remission is when blood sugars returns to non-diagnostic levels without medications. So as a side note here, for someone with type 1 diabetes or with LADA, they will always need those meds, specifically insulin most likely, definitely for type 1 and likely for LADA too. However, for someone with type 2 diabetes or prediabetes, we can get those numbers lowered without meds the vast majority of the time. So when we get those blood sugars lowered to the point of being out of diagnostic ranges, for someone with diabetes, that would be, even if you get back into prediabetes ranges, that's considered to be remission. Now, like I mentioned on the previous slide, this is more commonly seen after weight loss surgery or starvation diets, sometimes even on keto diets, which I will go over more in a different video. But many people have achieved remission through whole food, plant-based eating. And again, like I mentioned on the previous slide, it's definitely the least traumatic way to go, and it's the only one with good side effects instead of bad ones. Many factors determine if remission is possible for an individual. So if a program is just straight up promising you will achieve remission, You should be leery of that because it's not necessarily possible for everyone, depending on the damage that's already been done to your body from high blood sugars, things like that. But it is possible for a lot of people. So, in other words, everyone can stop the progression of insulin resistance and improve their insulin sensitivity, but maybe not quite everyone can get all the way to the point of remission, but a whole lot of people can. So what about a diabetes cure? A cure would mean that you never have to worry about your blood sugars ever again. Someone who has been diagnosed with diabetes in the past, even if they have achieved remission, really should always be aware that they have a propensity towards elevated blood sugars. And even if they've changed their lifestyle, there are things that can cause their high blood sugars to come back, like steroid medications, pregnancy, if they ever have to have an organ transplant or other medical conditions, even just stress, a decrease in physical activity, or potentially just aging or changing their eating habits. Any of these things could cause high blood sugars to come back. So if you've ever been diagnosed with diabetes, you always just want to be aware that you may have high blood sugars again in the future, depending on your life circumstances. You should be very leery of anyone promising you a cure for diabetes. So here's a little summary, and I should just mention that this is talking specifically about type 2 diabetes. So improved or well-managed blood sugars is basically always possible. Decreased insulin resistance, always possible. Improved insulin production, newer research indicates that this could be possible as well. Remission is often but not always possible. And being cured, you should be very leery of, as there are not currently cures per se for any type of diabetes. And sometimes people find that maybe discouraging that there's no cure, but think about when you were first diagnosed. Most people were told that diabetes only gets worse and worse over time and not better. And that is just not the case. It definitely can get better, even to the point of remission. And I find that to be incredibly encouraging. I myself, as a health professional, didn't even know that. I was working in diabetes. I was never taught about remission until I did the research and found that out myself. And that is just so exciting. That is so much of why I do what I do. I want other people to know that you can reverse diabetes and pursue remission. That should always be the goal of treatment for type 2 diabetes, is to continue pursuing reversal with hopefully even getting to and maintaining remission.